pretty much a new device to the ED. They used to use it on the surgical floor all the time for post-op patients. The risk of infections of constantly cathing people is so high that they're trying to get away from putting a catheter in, and there's actually Medicare standards now that there has to be a good hard rule before we put a catheter in. We can't just put a catheter in everybody that we want to, because we don't want to get them out of bed, because we don't have to want to deal with them getting up every 5 minutes. So for people that maybe come in for urinary retention, we go get this, or we put a Foley catheter in and we're not getting any urine out. We're almost positive that we know that they're in the right spot. We can come through here, and in your folder again, there is a manual setup. So verifying the scan, re-aiming, and part of the problem is just getting in the right position to scan the patient, because that's everybody's bladders can be kind of shifted to the right, shifted to the left, and the ideal one is going to be right above that pelvic suprapubic bone. All right, so we're going to just turn our machine on, and we can just go straight to the scanning. And there's a little gel on the side, so we'll put it just like the ultrasound machine. Basically, that is what this is a portable ultrasound machine. Works on sound waves. We will go ahead, and unless somebody wanted to be the patient, we'll do it right here. We put gel right on there, and we can move this around, and it's like a gun. We're going to go ahead. It's going to show you arrows all around. And what it's basically doing is correlating with the circle on the screen. And it may tell you to move one way or the other. And on here, it's kind of giving me all of them, because it can't find any kind of scan. But you may notice that it highlights over here, and you'll move the probe over there, and if it arrows, and you're just kind of moving to try to find it. But if you start dead center under the umbilical and right above the suprapubic, start there and just kind of start scanning around. What it is going to do is it's going to show up yellow. And if you're getting a yellow, but it's only right up in here, move your probe up. What our ideal picture is going to be is that the yellow is all included into that circle. Because what it's going to do is give us a volume for whatever's inside this circle. So if we're missing half of the bladder and it's only yellow up here, it's going to tell us that there's only 10 cc's in the bladder. When we move it down here and all the yellow is within that circle, then it's going to say maybe 100 to 150 within that bladder. Okay, so it can give us a false reading if we're not right over the right area. And that is pretty much, we aren't using any of the print buttons, and then to go back to the home screen was just that soft key down here. Okay, and that's pretty much all that we're using it for in the